Hello, I'm Yula Kim from HIMSS and welcome to today's webinar. Thank you for taking the time to be here today. We have an exciting program for you, but before we get started, I would like to highlight a few things so you know how to participate in today's event. At the bottom of your screen are multiple application engagement tools you can use. All the engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you need technical support during today's event, click the question mark icon in the navigation menu at the bottom of your screen to find answers to frequently asked questions, or you can use the same box to submit questions to the speakers at any time. And if we don't get to all your questions today, we will follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. If you miss anything, don't worry. You'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. Now let's get started with today's program. Connected Healthcare Innovation, how advanced connectivity technologies such as 5G will help drive healthcare growth, sponsored by Communication Technology Services. Here's our agenda for today. 1. Digital disruption in healthcare. 2. Trends in healthcare networking. 3. Private wireless networks for healthcare. And 4. The wrap-up and Q&A. Our speakers for today are Randy Bush with Deloitte Consulting, Justin Green with CTS, and Robert Cerbone with CTS. With that, I'll hand it over to you, Randy.
Well, thank you, Eula. It's very excited to join you here today and talk a little bit more about digital disruption in healthcare. I'd like to start out discussing a little bit about some of the foundational shifts that we're seeing in healthcare. And we're undergoing many structural changes and transformations, largely coming out of the COVID-19 environment and other market forces as well. And so advanced connectivity actually is going to be a key enabler for many of these post-shift considerations that we're seeing. So let's talk about a couple of them. First and foremost, this general trend of sick care moving towards well care, where we're focusing more on restoring health, looking at preventing disease, and also promoting overall well-being versus continuing to treat medical chronic conditions. And so when it comes to the advanced connectivity imperative, we're really looking to enable the collection of real-time data to facilitate both early and immediate impacts from interventions. So this will provide some new capability. Secondly, we're looking at this shift from the episodic more to the continuous care paradigm. So healthcare is no longer confined to just that 20 minutes you might get in your doctor's office. We can now look at care that's being delivered and the data that's being collected from it and fed back to providers that's continuous. It's enabled via technology such as remote monitoring and a lot of capabilities that we're seeing introduced into the marketplace. In this case, the advanced connectivity imperative really focuses on empowering those patients to manage their own health anytime and anywhere with this broader connectivity. Third, I'd like to talk a little bit about this general shift we've seen over the last few years of volume to value. And these new novel payment models are looking to push us more towards value-based care as we redistribute risk between both providers and payers. And we're also seeing the quality of outcomes versus the number of encounters being rewarded, which is a very important shift across the industry. In this case, the advanced connectivity imperative is really to use this data and information to inform these risk models in more real-time application, not at the end of the month or the end of the quarter, or possibly at the end of the plan year, but trying to make more important, timely decisions around care encounters. And last, we'd like to cover this shift from provider-centric to more patient-centric or consumer-based care, where we're seeing historically systems were aligned around providers as the primary stakeholder. And now that's shifting. This is the power shifting more towards the patient, their outcomes, and the experience they have with the different facilities and providers that they interact with. So this is important from an advanced connectivity imperative when you think about both the increased convenience and the personalization that integrates with consumer-owned devices and the data that those devices collect. So next up, I'd like to talk a little bit more about the healthcare strategic imperatives. And you'll see here, in response to these disruptive shifts, industry leaders are really connecting and concentrating on several specific focus areas. We think these are critical to ushering in the next era of how healthcare is delivered. So first up, I'll talk a little bit on the right side here about data sharing. there's a much stronger willingness and sense of participation around consumers and their ability and willingness to share data. So this increased transparency is really becoming more standard practice in data use and collection, and it's increasing the ability to drive consumer trust with the willingness to contribute towards one's care. There's also some financial incentives we're seeing to ensure both individuals and various different institutions participate in data sharing. And the advanced connectivity here, really, the cool thing is it enables the data sharing by supporting exchange of large files or other applications that might require high bandwidth. Next up, I'd like to cover interoperability in terms of data. And the data architecture and the analyses being formed are certainly transforming as well. So we're seeing a large aggregate set of data and data sets that are provided in real time and gives a view of the consumer and often details about their environment too. So these data sets enable advanced analytics to generate novel insights and do it very, very quickly. The data can be standardized, it can be aggregated, it can be stored, it can be continuously updated. And the reason for the advanced connectivity here is really around enabling the data flow between sources, which can be done much more securely and much more quickly. Next up is equitable access. And we're moving away from where socioeconomic status might dictate healthcare access. And these traditional barriers to healthcare around geography or resources are certainly being significantly reduced, as well as the cost of wellness of care. It's really plummeted thanks to additional data sharing and interoperable data. And so more patients have tools at their disposal, low-cost, accessible tools to help activate and achieve better wellness and overall well-being. So the advanced connectivity opportunity here is really around expanding other healthcare options to patients who might have traditional challenges accessing more customary provider settings. Next, I'd like to cover the empowered consumer. The empowered consumer really demands the convenience, the transparency, and some customization as well. So what we're seeing is consumers are driving the pace of change. They're no longer passive participants here. They demand transparency, convenience, and access. And what's happening is the market's now responding with more of a patient-centric approach. And they're creating more access points as well. So the advanced connectivity here empowers patients really to take some more ownership of their own well-being with this anytime, anywhere approach, using devices that they often already have and may not think of first and foremost as a healthcare device, smartphones in particular. Next up, behavior change. So people are influenced via these digital tools. The introduction of digital tools that can be tailored to consumer interests and their health status actually empowers them to take a little bit more responsibility for their health and their overall well-being, particularly in the area of nudging. So advanced connectivity here supports helping patients really make the right decision when they're not quite sure, and it enables these personalized nudges. Might remind you to log what you had for breakfast, or remind you that you haven't stood up for a while or need to take a walk. And lastly, the scientific breakthroughs here we think will continue to happen at an exponential pace. We're seeing building on insights that come from the marketplace and from the interoperability of the data. We're both seeing disruption with new entrants in the marketplace, things like access to more timely or more diversified clinical trials, or more increased participation from a broader set of participants. And lastly, this will allow us to unlock potential innovations in advanced connectivity and really link more of might have been science fiction in the past to what could actually play out for folks in their everyday lives. So next up, I'd like to advance to talk a little bit more about the marketplace and the industry convergence. So in response to many of these disruptive forces, the boundaries within what traditionally might be the life sciences and healthcare industry are really blurring, with adjacent offerings that are coming together from other industries. So instead of seeking medical care from a traditional physician's office, you now can obtain basic care from a major retail or grocery store that might not have existed years ago. And sometimes patients are even skipping their primary care physician's office and going towards more direct to consumer options. You may have heard of some of these things that you might see at Smile Direct Club or Everlywell, or even 23andMe has an option like that. So both an established consumer and various tech companies have taken notice of this. And what they'd like to do here is really advance their technologies and apply them in healthcare adjacent settings, both or either organically or through various different acquisitions of niche players, which, for example, you may have seen the One Medical acquisition by Amazon recently as well. Third up, these technology companies really find themselves in the broader life science healthcare landscape around personal electronic devices, smartphones, smartwatches. These are used to increasingly connect data and connect back to overall well-being and wellness apps as well. So, and lastly, the tech companies really are interested in also integrating themselves into life science healthcare organization through their core offerings. So think of cloud applications or cloud service providers, AWS, Google, Amazon, that provide a foundational infrastructure for many healthcare companies to aggregate and store and secure much of the data that's being generated in the marketplace. Next up, let's talk a little bit more about the connected enterprise. There's certainly some very impressive trends in connectivity, which you'll see here on the right-hand side, that really just hint at the immense amount of continued growth we're going to see here. And what this does is it's going to drive this continued digital innovation. And we have a choice here as an industry on how to respond. First and foremost, we could stick to our knitting in the ways we've done our traditional business. And we'll see some growth, obviously, in the short term. But there are many areas that require explanation and understanding of the innovations. Otherwise, there is some concern for potential disruption. So the areas around investing in connectivity that are going to be important are things that allow you to get closer to the patient, things that allow you to differentiate and have a more connected patient experience, a more engaged patient experience, and the ability to then leverage data for operational improvements in one's organizations, to enable new modalities of care through digital and the technical capabilities in the marketplace, and also looking at what areas have that highest ROI. Things that we're seeing so far are things that are thoughtfully connected and in concert with other technologies. For example, artificial intelligence and advanced analytics, or blockchain capabilities, or AR, VR in terms of treatment options as well. So next up, I think it's important to mention a few things about, what are we seeing around the globe in terms of early investments in advanced connectivity. And as we continue to learn and every day new information becomes available, industry leaders are really trying to understand where these pilots and investments are occurring. And for example, we see the idea of an innovation campus that allows advanced connectivity to connect to other emerging technologies occurring everywhere in the US at Emory University, or in Finland at Oulu University Hospital, and even in Thailand as well. And some of the maybe one consistent theme is this idea of partnerships, and each organization has an ecosystem that's becoming increasingly important as it starts to explore both the emerging technology and the applications for how to use it in its organization. And most health systems we're seeing are working with both network providers, companies like Huawei, AT&T, Nokia, Vodafone, Verizon, as well as hyperscalers, the AWS, Google, Amazon organizations out there, and the systems integrators or third parties that can help bring the different components of these organizations together. So very exciting. We'll see continued examples of this all over the globe. And before we wrap up my section, I'd love to tell you a little bit more about just the future of health. Life sciences and healthcare is very dynamic. It's very complex. And we've begun to study many of these trends here and focus on what we call the future of health. And what I'd like to leave you with is just some resources here. You'll see some recommendations that you might want to consider reading on your own time. that allows you to better understand how these trends are impacting not only life science and healthcare, but the patient as a consumer, the provider network, the relative other entities within life sciences and healthcare, and the technology and consumer businesses that are also interested in getting a larger share of the industry and hopefully improving overall well-being. Eula, thank you. I'll turn it over next to Justin.
Thanks, Randy. Interesting stuff. Thanks, everybody, for joining today. I'd like to talk first about the main network types that we find inside of our healthcare system, our hospitals primarily. Like I said, three. Wi-Fi is everywhere. And per the latest HIMSS study cited there, 85% view it as critical to providing healthcare. It's essential. Medical data applications, access to electronic health records, voice over Wi-Fi, and if you've been in a hospital visiting somebody or in yourself for an illness, you realize that it's also pretty critical to patient and guest connectivity, right? Streaming Netflix in your room would be one main application there. It leads all other forms of communication in challenges related to security at 64%, latency at 55%, and bandwidth at 68%. In particular, video streaming is very bandwidth intensive. It's the most bandwidth intensive thing that you can do on a laptop or a smartphone. And Wi-Fi, it should be noted, is best effort. The spectrum is unlicensed. Anybody can purchase and operate an access point. You don't need a permission from the FCC. And so with that, we also see that a challenge of it is there's no quality of service assurances. Cellular or voice, in other words, bringing a carrier's network. Carriers in our country are Verizon, AT&T, T-Mobile, and an up-and-comer Dish Networks, also beginning to operate a cellular network. 67% of those surveyed view this as critical to providing healthcare. The important thing to note when you bring a carrier's network into a hospital setting or any setting is if it has certain amplification powers, which are typically utilized in a larger building, it's subject to the express consent of the concerned cellular carriers. So we have to get permission from the cellular carrier in order to extend their network in a robust professional fashion into the hospital. Voice collaboration over carrier networks is an important application. People need to be able to talk on their cell phones, both providers and patients and visitors and hospital staff that don't provide care. It's important. 63% of folks surveyed report challenges with this mode of communication, especially in multi-hospital systems and integrated delivery networks, including some of our customers. This is the highest of any technology. In other words, the most problems exist with this type of communication inside of our hospitals. And then wired Ethernet, stuff that's actually connected to the jack on the wall. 45% view it as critical to providing healthcare. There are mission critical applications supported by these wired networks, including wired medical telemetry and image processing with large files. And there's not a ton of concern, relatively speaking, to the flaws of these or challenges of these networks in contrast to Wi-Fi and cellular, with only 36% of folks reporting issues with a wired network. I think it's important to point out that behind every wireless network, including Wi-Fi and cellular or mobile network operator networks, are wires. Next slide, please. So there's a host of applications going on in a hospital. I can't think of another building type or venue type in our space that we deal with that has more going on. There's a lot of stuff going on in the air inside of your average hospital. You have pharmaceutical security networks, EHR. So one of our largest customers recently switched to Epic. It was all consuming. It took them many months and all hands on deck, nights, weekends, to make this switch to their EHR system. I asked them why that was, and the response was pretty interesting. They said something that Randy had uncovered earlier, which is we're making a transition from the way that things were, which perhaps was a more provider-centered type of care, to a system of care where the patient was at the center. It's a patient-centric system. Medical imaging, as I mentioned earlier, a lot of big files that need to be moved around. Patient vitals, and that can include wireless medical telemetry or also wired medical telemetry, right? Drug administration, asset tracking, stuff like infusion pumps and wheelchairs. Can even go so far as infant tracking systems, which are utilized in labor and delivery units to ensure that babies remain safe and stay with their parents and nurses. Building management systems, I was thinking about, as Randy was talking, the proliferation of IoT devices. We certainly see wearables, but now all of a sudden the thermostat has an internet connection, right? A light sensor has an internet connection. Buildings are becoming smarter and greener, and there's a proliferation of edge devices for building management systems. Obviously, doctor and caregiver communications, unified communications are an essential part of any hospital network. Thermographic screening, this is really an effect of the COVID-19 pandemic, where when you walk into a hospital, you're screened to ensure that you don't have a fever. And of course, patient and guest connectivity. Our hospitals are actually managing kind of indirectly your user experience. And part of that is, can you be entertained? Can you connect to the folks that you love and want to speak to when you're inside of the hospital? That also applies to visitors, right? So a couple of interesting quotes from our customers here. An associate CTO of Advent Health, one of our customers, said, if you give me a real high bandwidth, low latency, and ubiquitous connection, ubiquitous being the important word in that phrase, I will find ways to use it. Another one, clinical workflows are increasingly dependent on communication to patient cellular devices. This particular CTS customer pushes a lot of information and a lot of the user experience inside of their facilities to their own app, and that app resides on your cell phone when you bring it into the hospital. Next slide, please. All right, so we know what the networks are. What challenges are we facing trying to operate these networks? We have a transformation to improve operational efficiency while becoming more patient-centric. You see that theme again. Collaborative communications and consistent collaborative communications require high reliability, priority access, and low latency. Our healthcare customers really manage, I believe, from crisis to crisis. They have outages which affect their ability to provide care and ability to make money. And it seems like there's always something that's pressing that they have, fires to put out. So high reliability and, ensuring uptime is really mission critical for them. We have IoT sensors, which are, if they're medical and, transmit patient vitals, must have high reliability, Patient care requires real-time data monitoring and analysis. Randy kind of touched on this a little bit with the analytics. Mobile imaging equipment requires a tremendous amount of speed, and also we're starting to see mobile imaging stuff which connects over wireless networks as opposed to wired. Currently, the networking technologies can't meet the demands being placed on them. Ethernet is tethered, right? You can go too far from the switch in the closet or the jack in the wall. Wi-Fi lacks the security, reliability, and discrete prioritization needed for these trends. And mobile network operator networks, LTE networks, don't offer policy customization. When we bring a carrier's network into the hospital, it is still their network. We don't have visibility as the provider of this network, nor does the hospital into the ones and zeros going across this network. It is the cellular networks it is the cellular network operator's network. And we don't have any visibility into that. And thus, we also don't have the ability to policy manage, nor does the hospital to deliver any kind of customization. The other thing that's important to note about carrier networks inside of a hospital is they require carrier interest for participation. This is the number one problem with building cellular networks inside of a hospital. There are tens of thousands of buildings out there that are large enough to warrant cellular reinforcement, and they all require intent from the carrier in order to connect their networks to a neutral infrastructure that a company like CTS would build. Biggest challenge out there. You build the network. Will the carriers come, and will they come on a time frame that's useful to the hospital? In contrast, private wireless networks, which you'll hear more about from Rob here shortly, deliver some efficiencies and cost savings. It has some of the benefits of the carrier network in that it is also an LTE network, which enables a broad, high throughput coverage at places that are specified by the hospital, as opposed to when we build a cellular carrier network. Frequently, we're required to place these networks or build them where the carrier specifies. Because it's LTE, the original technology built for mobility, it's very good at mobility and efficient at handoffs. One of the things you'll notice with Wi-Fi is that it's not very good at handing off from access point to access point as you transition, let's say, down the hallway in a hospital. It is a break before make versus make before break connection. So in other words, if you're sitting in your driveway, often I do this, I'll punch in a destination that I want to travel to on Waze or on Google Maps. And as we start to head down the street, my phone connected to my car will still hear my Wi-Fi network from my house. I have to get down about 5 or 6 houses down the street before that connection is finally broken and my phone transitions over to the carrier's network that I use. The other interesting thing about these private LTE networks is they don't work. The edge devices do not work unless they have a SIM card, which can either be virtual or physical inside of the device. So really, devices that are on these private networks must be authorized. There's no other way for them to connect. In contrast to Wi-Fi, where anyone with the Wi-Fi SSID can connect. They may need credentials to access the network or simply to accept the terms and conditions, but there's no SIM card based security. These networks can be built for anywhere up to 5 nines. We can also customize the network to 4 or 3 nines if necessary. And they offer the enterprise, in this case, the hospital, complete control over the network and visibility into the data being used or traveling across the network. Next slide, please, you all. Thank you. So, wanted to close with some voices of our actual healthcare customers. They can tell you better than I can tell you. One of our largest multi-state healthcare entities out there had these 3 quotes on the left in their strategic wireless roadmap. Their strategic wireless roadmap included all of these types of networks that we've discussed today. But some things I wanted to highlight. We continue to see bandwidth growth on cellular devices for both video and data-driven applications. Some of that they're driving themselves, same entity as I had mentioned earlier. But folks are using more and more cellular data. That's a general trend going on in our world. Is people are using their phones for work, for play, and to connect to the ones that they want to speak to on a regular basis. So those are placing demands on the broader cellular networks. Many carrier-specific point solutions are available, but none are optimal or scalable. When referring specifically, I think, to carrier, mobile network operator networks inside of the hospital. And related poor cellular coverage within the hospital system, our hospital system, remains a big issue. It limits the mobility of our clinicians for communications inside hospitals and MOBs, and also patient connectivity, right? The patients can't connect to hospital services or the third-party services such as streaming video while inside of their facility. Two additional quotes here, which I found I thought were interesting. From the Associate CTO of Advent Health, again, we got into in-building cellular because we measure process flows and their impact on health and fiscal outcomes. He actually told me that they started doing in-building cellular for one doctor originally, and it was a cardiothoracic surgeon. So you come into the hospital, with chest pain. It's, you go through some tests in the cath lab and it's decided that you need open heart surgery. Something would happen there. The surgeon who would be performing your surgery would reach out to the anesthesiologist on call. And he said to me, we didn't want that connection to go over 1950s overhead paging technology, Justin. We wanted that connection to be assured, and whatever it took in order to make sure that doctor's phone call could go through, we were going to enable it. And they started building indoor cellular networks as a result. Another interesting quote here, which builds on the security point made earlier. The security aspect is key. All of these communications are governed by HIPAA, right? Text me the results. I'm on a golf course. We can't. It's a HIPAA violation.
Hey, everybody. I'm Rob Cerbone. I'm going to continue the discussion here and talk a little bit about private wireless networks and continue the information that Justin was just talking about. So, Rachel, next. So really, when we look at kind of what Randy was talking about and then some of the challenges that we're seeing today with existing networks within our customer base, like Justin voiced, it really kind of begs for a new kind of enterprise network, something that's got a lot of operational flexibility that provides coverage where you as a healthcare provider want the coverage, a high degree of security. Reliability is just assumed. I mean, it's got to be very reliable and low latency because we're doing life-saving here. It's not, Justin and I were talking about mission critical and business critical applications, and he brought up, well, there's mission critical and then there's life-saving, which is like a whole nother step, right? So that's a lot of what we're dealing with inside of a healthcare facility. And so it really begs for a new kind of network, right? You still have a lot of different things going on inside of healthcare to automate things that are happening. Randy spoke a lot to this, but one stat that I've seen that really kind of spoke to me was that there's still a lot of manual processes inside the facilities. And on the order of 50% of caregiver time is spent away from patients looking for things, right? Looking for, an IV bag holder, looking for a wheelchair, looking for, a gurney, hopefully not looking for a child. That's a whole other degree there. But to the extent those things can be automated with a new technology, that would take their time and make it back available for them to actually give care to the patients, right? And that's what it's all about, is trying to become more patient-centric. There are a flood of new digital technologies that provide the opportunity for automation of these types of tasks and analytics. And again, Randy spoke a lot to that. The challenge is really connecting all those applications together so that you've got that data and the ability to provide those analytics back to the caregivers. And that process, or that walk of digital transformation, is still in the early stages. This data point is 30% of healthcare institutions report having a formal digital transformation strategy in place. I think that was accelerated a bit by COVID. And I'll talk a little bit about some of the applications that we've seen that for sure came about because of COVID. And we still see a lot of requests for wireless infrastructure in new builds, right? I mean, as Justin mentioned, that's table stakes. Even for a wireless network, you've got to have the wires to be able to connect to it. But in existing hospitals, it's very difficult to go back and kind of rewire the hospitals when you start to kind of change the layout of rooms or even the function of different rooms. So wireless has a lot of different benefits just in terms of operational flexibility. And then, we've talked a lot about Wi-Fi. Justin threw out a great stat in terms of the Wi-Fi is really one of the highest rated technologies by healthcare professionals that they need to do their job. But because of that lack of kind of out-of-box security and the reliability and challenges with throughput on those networks, which really go back to kind of interference issues that are inherent in the way that Wi-Fi is transmitted, really it's led hospitals to wire where they can and use Wi-Fi only where they have to extend that mobility. So if you've got a network that can deliver some level of network convergence to eliminate the multiple networks that are sitting out there in the hospital or healthcare facilities today, you can reduce your overall spend, which then will make money available for some of these other types of applications. Again, always focus on mission critical nature of those communications. So the ability to have reliable communications, but also, very low latency, high bandwidth, prioritize certain applications, communications for doctors over communications for, people that maybe are just facilities workers, like cleaning up different parts of the healthcare facilities. And then those business critical communications, things that would require very high reliability, very high security, very low latency, could be robotics, could be voice, but those types of things need to be able to occur. And you can do those to a very high degree on a wired network, but on a Wi-Fi network, it's difficult. You can prioritize the connectivity when it gets back to the wire, but over Wi-Fi, there's a lot of different challenges to try and create a policy that's actually enforceable. So what we're going to do is talk a little bit about kind of a new application of an existing technology next. So what is a private wireless network? A private wireless network is really the application of proven cellular technology. So the same LTE or ultimately 5G technology that folks like AT&T and Verizon and T-Mobile and every major carrier throughout the globe, the same technology that they use to deliver your service to your cell phones and to your other mobile devices, but actually applying that for use inside the enterprise. And so there's a few things that we'll talk about why this is a benefit, but one of them Justin had already highlighted. It actually uses licensed spectrum, right? So this isn't something where somebody can just come get a radio and stick it inside your facility and turn it up, which then is going to cause different interference patterns. It's licensed spectrum from the FCC, so it's not different from the spectrum that AT&T or Verizon pays billions of dollars for to be able to operate. So because the spectrum is licensed, you've got a high degree of reliability for what you can do on that network. And the other thing is that this is proven cellular technology, and there's a lot of benefits that I'll talk about kind of in some future slides. But it's a scaled down version of what someone like AT&T and Verizon would use that's put inside of the enterprise, of the healthcare facility. And the benefit is that it's your network, it's your data stays all on site, and you define the rules of operation for how that works. It's not the carrier defining the rules. It's not the carrier defining, where they're going to put the network if the coverage is sufficient for their purposes. It's you looking at your applications and making sure that you've got coverage where you want it. Next. So how did this come about? So there was actually a frequency band that's called band 48. It's the 3.55 to 3.7 band, 3.57 gigahertz band that was in operations, and it was really utilized by the DoD and some satellite providers that were using this for some of the same technology they use to distribute video signals to your home. But it was very lightly utilized. The satellite folks were using it kind of on the coast in a handful of areas, and the DoD, the same thing. I mean, they're using it on kind of ships when it pulls into port. They've got a great demand for it, but throughout the entire contiguous U.S., it was very underutilized. So the FCC, in their quest to find additional spectrum to commit for different types of applications, embarked on a journey to free up this spectrum and create some rules around it so that those incumbents could still use the frequencies when they needed to, but really make this frequencies available for new innovative purposes. And in fact, it's kind of called the innovation band. They changed the way that it was licensed because you've got these incumbents sitting in the band. There's a function that sits out there. It's called the SAS that I'm not going to get completely into, but it's basically the traffic cop, and it looks for usage by the DoD or the satellite incumbents and kind of steers the usage around that. So there's a lot of spectrum available, actually up to 150 megahertz of spectrum, which is what most of the carriers have in any one specific location. And it makes that available for commercial purposes. And the licenses are available for a very low cost to the enterprise. I mean, they actually license this in 10 megahertz blocks, and they're licensed down to kind of almost like an individual operating area. So if you're putting it up, you would stand up a radio and you pay a few dollars a month to operate that radio, in stark comparison to what the carriers have paid for billions and billions of dollars for these licenses. And enterprise can get access inside their facility and put up a licensed network that would have a lot of the same characteristics of a licensed cellular network. Next. And from a technology perspective, as I said, this is really the same carrier-grade cellular technology that Verizon and AT&T are using every single day. So the great thing is that you've got LTE today, and we're in the process of moving this to 5G, but you've got this huge ecosystem out there of devices. I mean, there's virtually every smartphone that's come out in the last 5 years has this band available in it for use. And there's other devices that are out there to provide connectivity for things that do not have a wireless chipset in it. So Ethernet gateways that you can plug a device into that maybe typically would run on a wire, you can move it to a wireless network. And then it's more and more making its way into other devices that have wireless connections where you've got now embedded connectivity. So things like scanners and sensors, we're now seeing that we've got not only the technology, but we've got this band in there so you can do some immediate application use cases today. Justin also mentioned this. I mean, one of the great things about cellular technology is that it's developed from the ground up as a mobile technology. Every new iteration of Wi-Fi that comes out, Wi-Fi 5, 6, they're looking at 7 now. What they tend to do with all of those is, they really try and make it closer to what you have with a mobile network or a cellular network. They're trying to make it more mobile. They're trying to add quality of service. If that's really what you need, you're better off starting with a mobile network that was designed for those capabilities, because Wi-Fi still has to support backwards compatibility, which typically makes the network fall down to the lowest level of device that's connected to it. Here, mobile networks are designed for high-speed mobility, for folks that are driving down, not just the highways here in the US, but driving down the Autobahn in Germany, where you've got very, very high speeds. And that's important, for when you're outside the hospital, but even inside the hospital, the use case that Justin brought up, when you're just walking down a hallway, we've seen applications that are for, asset tracking or workforce management, where they take very, very low bit rate consumption on the order of kilobits. So it's not really a throughput issue, but you've got somebody traversing a network, and as they walk between access points, the lack of a handoff can cause an application to hang up, and the user maybe is trying to get a benefit, or the organization is trying to get a benefit out of now that automation, and they can't, because the user that's looking at the application is sitting there staring at a screen because there's no data coming in, because it's still connected to a Wi-Fi access point at the end of the hall. It hasn't broken the connection and moved over. Mobility networks are designed from the ground up. You've got centralized intelligence that's managing the network and those handoffs. It's looking in real time at the radio layer and the strength of that connection to the mobile device. And when it sees that there's a stronger connection available, it'll just move over to the stronger connection. It won't wait for the network connection to degrade so much so that maybe you still show 1 bar, but you really have no throughput, and the connection's rendered, not working. So that's one key benefit. Another one is security. You can do some things with Wi-Fi security. And as I said, every new Wi-Fi iteration comes out, they try and add more and more layers of security there. The challenge is it still relies more on the IT organization to configure a lot of that security. And what you've got with the cellular networks is you've got proven security that's been sitting out there for years and years, and it's SIM-based security. So, you can put a physical SIM in the device. We can issue those SIMs for you. The enterprise can buy SIMs, but those are SIMs that only work on the enterprise device. It's not a SIM that you take outside and run on Verizon. You can do that if that's what you want, but we issue that SIM, the user is authenticated, that device is authenticated back to the network, and it's authenticated back with your rules. You can actually tie that into any kind of policy management server that you might have running on the enterprise that says, okay, well, this user and this device, I want them to have access to these applications. We can actually configure each application that we have running on the wireless network to tie into VLANs or to tie into the existing security policies on the enterprise network very seamlessly, so that the wireless network just looks like an extension of your existing wired infrastructure. The next one is performance, and it's really in terms of kind of the build out. So this would speak a little bit more to the capital expenditures necessary to build these type of networks. In a lot of cases, you'll see these networks deployed as a small cell network. And so what that means is, if you're looking at the way that you deploy Wi-Fi today with multiple access points, a lot of the infrastructure looks very similar to that Wi-Fi access point that you would deploy today. In fact, some of the first people that were making this infrastructure for this enterprise applications were actually Wi-Fi vendors. So folks like Ruckus that make Wi-Fi infrastructure, they were one of the first vendors to make an LTE box that would go inside the enterprise. Because you have less licensing issues from the FCC around power limitations, we can pump more power through these boxes and you get better coverage. So in an indoor facility, we can actually put a radio in that, again, will look like a Wi-Fi access point. It'll actually connect over similar type of backend infrastructure in terms of cabling, very similar to what you'd see over Wi-Fi, but we'll get 4 to 6 times the coverage for that same type of network. And outdoors, we can use higher power. It's actually much higher. We can go up to, cover about 10 times as many access points. So that allows you to build out coverage areas where maybe before it wasn't practical to put Wi-Fi out there. And we see this a lot in kind of campus environments where you've got folks and they want to put out blue phones for security as people are kind of traversing the campus, or they're putting in video surveillance for, either for the campus or for parking garages, and they don't have connectivity there. And Wi-Fi is just prohibitively expensive to cover those broad areas. We can actually do something that makes a lot of sense with a private wireless network. The one thing that I'll say over and over, and I'll talk about in the next couple of slides over and over again, is really the QoS aspect. The thing that becomes very interesting with a private wireless network is that you as the enterprise can define the policies for the applications that you want traversing that network. And it comes back to really optimizing the performance of your applications on that network. So if you have something that's like, video surveillance and it's HD and you need to pump high def video over that network, we can specify, okay, make sure that this stream gets no less than, this amount of bandwidth on the network. And it always has that, so that you can do that. If you have something that is low bit rate, but needs to be, also very low latency because the data is traversing the network and it's going back to a server and then is getting crunched with some sort of AI type of capability to provide feedback and say, oh, okay, well, I'm seeing this patient's vitals move in this direction, and the server says, oh, okay, well, that's not good. That looks bad. Somebody needs to be notified. We can set those types of priorities up for each individual application on the network. So we can do that at the device level, but we can also do it at the application level. So if you've got a device that has multiple applications running on it, like maybe a smartphone that a caregiver has, when they're using that smartphone for voice connectivity to talk to other caregivers, we can prioritize that traffic over something, maybe that where they need to get the connectivity, but the data can be a little bit more bursty or tolerant of a lesser level connection, like maybe some of the health records coming through. You want to get them, and it's important that you get them, but the voice connection is going to be much more important. So we can tune that network really to any way that you want to do that to make sure that you've always got that optimal application performance. IoT is another area that applies not only to building management, so like light sensors or HVAC, making sure that somebody leaves the room, let's turn off the lights, let's turn down the windows or pull down the screens on the windows to make sure that we're getting that ultimate environmental efficiency, but also very important things like telemetry data maybe coming off of patient vitals or data that's coming off of an IV infusion apparatus, to make sure that that's getting communicated, that it knows to administer the drugs, or make sure that you've registered that, okay, well, it's been administered. Let's make sure that we know and it's been tracked appropriately kind of on the server side, and that somebody doesn't go and give them another service of those prescriptions. So these networks are really designed for IoT, particularly when you get to 5G. The air interface is designed that it can have thousands and thousands of devices connected per radio, which is another area where Wi-Fi tends to fall down. And as we've talked about, the ecosystem there. So these are all the benefits that you've got for cellular technology over kind of the existing Wi-Fi network. And then again, wireless affords you a lot of opportunities for operational flexibility that you don't have with a wire. Next. So one additional use case that's really evolving today is using this same network, so the exact same network, with some additional connectivity to the carriers as a improvement for in-building coverage. So Justin talked a bit about cellular in-building coverage and something we call distributed antenna systems, which is where you're really bringing, a T-Mobile or a Verizon or an AT&T network inside the hospital. And healthcare facilities are using that today, both to enhance the guest experience, but also for caregiving experience, right? Because they don't tend to have very good connectivity inside these buildings, and more, especially as new buildings are getting built. The new buildings have, a high degree of energy efficiency, which is great. It brings the operations costs for the healthcare facility down. But the challenge for wireless operations within a facility, especially the new facilities, is all these great things that they do to make the facility more energy efficient actually serve to prevent the signal from the outdoor, the macro network we call it, from coming inside the hospital and providing good connectivity. So that's why you really need to put these systems inside like a DAS network. The challenge with DAS today, as Justin mentioned, one thing is really the operator engagement. And really, they're wanting to pay for these networks or fund these networks, which we still see them do that, but they're really doing it for the largest type of facilities, very large university teaching hospitals, things where there's a high degree of foot traffic where it's going to impact their root metric scores, right? Where it looks like their network is not performing well. But you've got a lot of different facilities that are uncovered today from the macro network, right? And we see a lot of demand from customers that we have today for a solution to provide that carrier connectivity inside of these facilities, but it's maybe not the most cost-effective manner today to do that with a DAS because the healthcare facility themselves have difficulty justifying the business case as they get into kind of the mid-tier and the smaller enterprises. We've got a customer that we serve today that's a very large national facility operator, and they have DAS. Just to give you an idea, they've got DAS built out that's largely carrier funded in about 10% of their facilities. So that leaves 90% of their facilities without any in-building coverage. And they're looking for a solution. And actually, this type of a solution, this private wireless network, we can run both the private use cases for the healthcare facility to improve their operations, but we can also put something in there that's a neutral host model where we can bring in the carrier signal on that same set of infrastructure. So it becomes a much more cost-effective model to get both sets, both the private and the public network, into a facility, particularly at kind of the middle price and below. And so that's something new that's emerging today. We've got some trials going on with the leading mobile network operators, and one of the larger healthcare providers. But that's something that is coming down the pike that you should be aware of. That'll become another tool in your toolkit as you're looking to build out in-building connectivity for your guests and your patients, but also your hospital staff. Next. So I kind of mentioned this before, but the way that we look at these private wireless networks and the real benefits that you should see as an IT manager within the healthcare environment is it's your network, it's your data, and they're your rules. So this isn't Verizon's networks that's designed to meet their coverage requirements, right? This is your network. You tell us, where do you want the network? What are the applications you're going to run on the network? What's the performance that you require for those applications? And we will engineer the network for you. If you've got, a lab that's in the basement that needs to have, a high degree of throughput, or it needs to have something that's connecting at very low latency, we can do that. So all those things are designed custom for you. You control the network. We can do that on your behalf. And as I mentioned, these networks today, they're 5G ready from the core, and we're starting to see some of the radios come out. The device side is a little bit lacking, but we can put in a network that would be LTE today that will meet many of your use cases. And then when it needs to be, a lot of the infrastructure can be upgraded via software, so it's not a rip and replace to move it to 5G when that's available if you need to have that. It's your data, which is also very important from a security standpoint. The carriers talk a lot about 5G and 5G and the ability to kind of have high throughput and low latency. And when they do that, they talk a lot about, the edge, or they talk about a MEC, and they're really trying to bring their network closer to the customer, right? And what you hear today, a lot of it you hear on TV, and it ends up being, 5G has this performance and we're bringing it closer to the edge. But for the carrier, bringing it closer to the edge still may not be inside the facility, right? I mean, the carriers, if you go back 10 years, an average carrier had maybe 30 data centers around the country, and now they're bringing that out closer and pushing the edge out into the neighborhood. For some facilities, you may be able to get an edge node on site. But these private wireless networks that we're putting in today, we're putting a server on site, and we can remotely manage that offsite with very little bits of traffic for you on your behalf, so you don't have to know how to run the cellular network. But we'll keep all the data on site if that's where you want it. If you need to send the data off site, we can do that as well. But we put the server on site, we can do that data user plane traffic management on site. So we get very low latency and very high performance. And more importantly, all the data can stay inside the firewall. The only data that we need to go outside is the control plane. It doesn't touch any of the user traffic. So you keep all the data inside your firewall. We can leverage your existing security infrastructure. As I mentioned, all your kind of rules that you may have there, any kind of employee or data management systems that you've got for security. And it reduces the risk of theft. It kind of takes out any kind of failure issues on the security side by keeping all that data inside. And you control the data. You make all the rules. You decide who has access to it. No different than what you do on the wired network today. And you define all of those rules. So you define the rules of operation. We would work closely with you to understand what policies you have on your wired network, extend those to the wireless environment. And really, you're the only one that's defining that. It's only limited by your imagination. We can do things down to the device level, or we can do things down to the application level on the device. We can make decisions based on types of traffic that we see. It's video. It could be, some sort of protocol traffic for telemetry. We can make decisions based on all those things. We don't have to rely on, it's this SIM card. I need to apply a one-size-fits-all policy for that. We can be very, very granular in terms of the specificity that we apply to the application. Next slide. So what is the benefit to you is really improving your overall network performance. I would love to tell you that, hey, this is one network that you can put in and rip out all your existing networks, and they'll all go away and it'll be fully converged. That's not likely the case, as with anything. I mean, things will adapt over time. But there are a lot of benefits to putting this type of network in place today, even if you maintain your existing networks. As we've heard, Wi-Fi is a workhorse inside these environments. And as Justin mentioned, I mean, a lot of the patient and the guest experience inside a facility, there's a significant portion of that experience now that is attributable to their connectivity inside the facility. As strange as it seems, people like to post to their social network pictures of themselves, in various arrays of health, on their social networks. Hey, look at me lying in the hospital bed, all banged up. But people like to do that, right? They like to share and they like to consume video on the other side. And if they can't do that, unfortunately, that has just as much impact on their viewing of their stay, or their ranking of their stay, as it would the quality of the healthcare that they get themselves. So by moving some of these life-saving or mission-critical or business-critical applications over to a network that's really designed to handle them, you actually free up space on your Wi-Fi network. It's you think about it as Wi-Fi offload in reverse. So you can actually improve the performance of your existing Wi-Fi network without really doing anything to that Wi-Fi network. If you want to keep voice on DAS because you've got it, that's great. If your DAS is coming up towards end of life, we can always explore moving that to a neutral host model on these types of networks, and you'll get some efficiency in terms of cost. And keep your Ethernet networks. We're not advocating that any of that goes away. We actually need them to connect the wireless network too. But do migrate your mission critical services over to this type of network. Like, as I said, let's do what you want to do and how you want to do it. Let's put in a network, give you the control, define the policies that will optimize the performance so you can do your job better and not have to worry about the performance that you're seeing in the applications. That's what I've got there. So I'll turn it back to you, Alon, for questions.
Thank you, Randy, Justin, and Rob. We have time for some questions, and I would like to also invite Rachel Jensen, who leads Deloitte's LSHC 5G Advanced Connectivity team.
Alrighty, so we have our first question that came in here is, how do private wireless networks compare to carrier-provided cellular?
Rob, you want me to take that one?
Yeah, sure, go for it.
Yeah, I think you really covered it well in your slides. A couple of different slides really addressed it, but I think if we could summarize it in one word, that word would be control, right? When you put a carrier's network into a building, it is their network. The traffic on the network, the policies of the network, where the network is and who's connected to it in terms of the carriers that connect, is completely under the control of the carrier, right? With the private wireless network, it's also LTE or 5G. So you have those benefits, but the enterprise, in this case, a hospital, maintains control and ownership of the network and visibility and POS management, policy management, throughout the network.
What are the best applications for private wireless?
Yeah, so we saw a lot of different applications, especially during COVID. I mean, we're only on the third anniversary of kind of having the spectrum available, and it took a little bit for some of those applications to get implemented. And some of the initial things that we saw were applications for kind of pop-up connectivity. So that could be, they moved a lot of the triage outside of the hospital initially because they didn't really know what was going on with COVID or how to deal with it. So they put these pop-up facilities outdoors in the parking lots or just outside kind of the entrance to the hospitals. And some folks were running, long wired Ethernet cables outside so that they had that connectivity back to their HIPAA compliant networks. But we've seen applications where they actually use this as almost like a small fixed wireless network to do that connectivity, keep all the data safe and secure on their network and bring it back inside the hospital. Similarly, like Justin mentioned, I think in his use case slide, thermographic analysis was another thing that kind of we saw a lot of new applications of during COVID, where people would stand up infrastructure to scan people as they were coming into a building, right? So you use video with a combination of a thermographic sensitive video camera, and they could basically look at everyone as they're walking in the building, and rather than taking their temperature individually, actually scanning the people as they're coming in and using an AI backend engine to look at and see if there's any discrepancies or somebody's temperature falls outside of what was deemed a normal range to kind of pull them aside before they kind of come into the facility. Things that we're seeing in the near term for applications there's a lot of benefits from tracking. So tracking assets, and I talked about that. I mean, tracking things like wheelchairs, like drip infusion bags, any kind of portable asset that's inside the hospital. To the extent you can reduce the amount of time it takes the caregiving staff to find those assets, that increases the time that they spend on caregiving. And I know a lot of the solutions today that are available on Wi-Fi, they tend to want folks to deploy an additional SSID, which isn't always possible because there's already too many of those, and each new one you deploy causes interference issues. But we actually have the sensors available for mobile technologies today. There's a lot of asset tracking that's being done for fleet management outside of the hospitals, and we can take that same technology and use it inside of hospitals for tracking things like wheelchairs. And also, as Justin mentioned, I mean, infant tracking, which is, much more important. It's horrible if an infant disappears because they got stole or they got given to the wrong person or put in the wrong, they got put into the wrong bed in somebody's room while somebody else was sleeping. So that's a very real application. Video surveillance we talked a bit about for security. And then one thing, we hear a lot of is there's a lot of voice over Wi-Fi going on today. And I think there's a tremendous opportunity for the migration of those voice over Wi-Fi applications to a real cellular network, which was designed to do voice communications with a very high degree of reliability. There's a little bit that has to happen in terms of the ecosystem to get those embedded chipsets into some of these purpose-built devices, but I think that's a tremendous opportunity.
Can you talk more about how investments in connectivity will help drive business growth?
Sure thing, I can take that one. So I know that Randy had chatted a little bit about the shifts that we're seeing within life sciences and healthcare, and a lot of those are really driven by the explosion of data and the need to really capture and process that data. So advanced connectivity can really enable that continuous collection of data and the analysis that goes along with that to enable well care, as well as some of that analysis that needs to take place in order to inform those real-time risk-based models. And then in addition, as we're continuing to see healthcare become much more of a partnership and ecosystem-driven model, it also facilitates the sharing of that data between providers and their different ecosystem partners. A couple of other drivers that I can think of additionally is that as the healthcare system continues to be more patient and more consumer oriented, really being able to drive consumer intimacy, which ultimately leads to consumer and patient loyalty. And then finally, as we're seeing health systems continue to make investments, not just into advanced connectivity, but also into other emerging technologies. So that could be advanced analytics, augmented and virtual reality, any of those other next generation technologies. You want to make sure that the network isn't the limiting factor or the rate limiting factor that is preventing the health system from getting their full potential out of those other technologies. So if you're investing into augmented and virtual reality, you don't want a network that's going to have that picture be lagged and choppy. So really making sure that you have the technology infrastructure to support the full potential of other investments into emerging technologies.
This is another one for Deloitte. Can you name top 2 or 3 applications you are seeing?
I can kick off that one as well. I know that within life sciences and healthcare, within manufacturing, supply chain, and inventory, we're seeing that both on the hospital provider side from an inventory management or an asset tracking standpoint, but also going a little bit further back in the chain on the device or pharma side in terms of manufacturing within more of a smart factory environment. And then we're also seeing a couple of different applications within a hospital setting that have to do with the management of very large files or very large data, video files. So that could be things like sharing medical images or things like, again, augmented or virtual reality, making sure that you have the bandwidth to support that. And then finally, I'd be remiss if I didn't mention this. I know that a lot of what we've been talking about on this call has been facility-based private networks. We are continuing to see thoughts around expansion beyond the facility into virtual health, healthcare at home. I think that that is the natural evolution and the next step from this conversation.
I have another one. This is the last question we have time for. How do I justify a private wireless network to my management?
I'll take that one. I will tell you the way that our current customers that are planning to deploy or have deployed these private wireless networks have justified them. They've taken a look at applications which are typically running on Wi-Fi that don't provide them the uptime that they need. Specifically, one of our biggest customers was looking at, push to talk. Rob likes to call it Star Trek communications with badging. Other applications, physical security. They have some of their physical security infrastructure is backhauled over Wi-Fi. Creates a reliability concern for them, and doesn't provide them adequate quality of service. The other thing we touched on quite a bit is infant tracking. That's also a Wi-Fi based technology, which, at least per my customer, doesn't work well on Wi-Fi, and is something where if it doesn't work, it requires mobilization of physical security guards to guard the doors to the OBGYN or labor and delivery unit to ensure infant safety. So we can help out with the justification for return on investment if we can understand better what the problems are that you have with your current communications networks. A lot of that's Wi-Fi, of course. Share the details on that, and we're happy to customize a network that delivers ROI for the given facility.
Justin, I would add to that too. Just the idea here that you're trying to couple strategy with technology to enable operations. So my advice might be to look at it from those different dimensions to really justify the support, because you may not have it immediately in your specific department, but when you start to think about the future and the impacts around value-based care and the connectivity of the customer and what they're expecting in the future, the business case will become much more apparent.
Now we have to wrap up. Once again, we would like to thank our sponsor, CTS, for their support of this webinar. Don't forget to take our brief evaluation at the conclusion of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to rewatch the on-demand recording of today's session, and it will be available in the HIMSS Resource Hub for a limited time, so feel free to come back and watch at any time. Thanks, everyone. Have a great day.